physician on the team. So my role is centered on sort of the medical aspect of their care. So we treat with the 3P approach, so pharmacological, physical and psychological. So I take care of more the pharmacological aspect. I will prescribe certain pain medications to help them with their pain. Realizing that this is only one part of the treatment. Medication will help maybe 30 to 50% in reducing chronic pain, but it doesn't take all the pain away. So the patient has to realize that this is really a multi-pronged approach and that they need to do more than just take the medication to get better. So that's my role within the team. I'm also sort of a bit of the leader of the clinic. We do take the history from the patient together, and I do a physical examination on the patient with the physio as well. And then we come up with a plan for the patient at the end. In terms of follow-up as well, I do most of the follow-ups of the patients, so I follow them usually at 2 months, 4 months, 6 months, according to what their needs are. And we have a different clinic for this where we do our follow-ups, which I do with the nurse.
I'm the pharmacist associated with the chronic pain team, and my role with the team is to assist the physician in selecting the most appropriate medications for our patients. I help monitor the medications in terms of how well they work and whether or not they're causing any adverse effects. On the initial selection of therapy, I also make sure that there's no drug interactions, and we check for weight-based dosing to ensure it's in appropriate range. Help to ensure that the medications chosen are affordable and covered under their family drug plans. And in between sessions, I connect with the families to identify if there's any drug therapy issues, if we need to adjust medications in between sessions, and how to manage side effects. I also educate families on the medications and what to expect from them in terms of onset of treatment benefit and any potential side effects and how to manage that.
My role on the chronic pain team is I'm the nurse case manager. So I am the primary contact for children and family, children, adolescents and family living with chronic pain, because chronic pain affects the entire family. I'm also the main contact for the child's school. If they're having physiotherapy in the community, I'm also the contact just to liaise back and forth with their school, with their community physicians, or sometimes whatever treatment they're having. I'm also the primary contact when they calling for any issues, whether it's if they have any questions about pharmacy, if they have, or the medications they're on. I'm the primary contact, and then whatever they need, I will disseminate the information to other members of the team, depending on what the question is.
So a physiotherapist looks at the physical aspect of things, so how someone moves, whether they're able to do the things that they want to do. So the way that we help the patient is really through setting goals and looking at what their life is like from the physical component, and then what we need to do to get them back to where they need to be. So it could include things like a stretching program, exercises, massage, physiotherapy services. We really look at more of the physical aspects of things to get them back into the life that they want.
I'm the psychologist on the multidisciplinary team. We know that often chronic pain impacts on a number of social activities, going to school, just participating in extracurricular activities, and when you're not doing the things that you enjoy and that your regular activities, that can impact on your mood and how you're feeling. So the role during the initial consultation is really to, my role is to understand and ask questions about how your chronic pain has affected different aspects of your life, how it's impacted on how you're feeling and your emotions. As well as how we talk with families and parents to get a better understanding of some of the challenges that they're having in terms of helping you with your chronic pain.
I'm a social worker on the chronic pain team. And my role on the chronic pain team is to meet with the parents of the child who's presenting at the clinic. And what I do is I like to meet with the parents to talk about family dynamics, any family stressors that might be impacting on the child's chronic pain.
So the Chronic Pain Clinic brings together many different disciplines in an interdisciplinary team. So all the health professionals sit around the same table so that the patient and the family only have to tell their story once. What that does is it really makes it so that we get all the approaches necessary to help this patient and family with chronic pain, really to help them see the evolution and to get through things on all aspects.
So what can patients do at home in between appointments? My strongest recommendation to any new patient accessing care through the chronic pain team would be to try as much as possible to follow through with the recommendations made by their specialists. We have a 3P approach to our treatment plan: pharmacological, psychological, and physical. So if they can try as much as possible to take the medications as instructed. In between sessions, if they can report any concerns with those medications, that would be very helpful for us to treat, to target. If they can follow through with the exercise and physio recommendations and their appointment schedule, they will achieve better effect. As well as the psychology. We generally recommend psychology for most patients, and when patients adopt all three treatment strategies, they do so much better. In addition, if they can try to focus on their functioning, so getting back to school and getting back to their activities, that helps to reintegrate into their life if they've been out of school for a while. And overall, I would say if they could adopt a healthy lifestyle, which would include exercise, a well-balanced diet with nutrition, good sleep hygiene to try to get a good sleep each night, and healthy coping strategies for stress in order to achieve all of their outcomes.
So patients, when they come to the multidisciplinary chronic pain clinic, have to realize that this is a different kind of clinic. This is not a clinic where they're just going to see the doctor, the physician, get a prescription and then go home. This is really an interdisciplinary clinic, meaning that we are few disciplines working together, and that we're going to be coming up with a plan that includes all these disciplines. So the physiotherapy, the psychology, maybe social work, pharmacy. So we all work together. So patients have to realize that this is going to be a long appointment because we're going to be taking the history all together. Then there's going to be the physical examination part. Then they go back to the waiting room while we put our heads together, and then we bring them back. We give them our plan, but we also do a lot of teaching at that point in time. So we explain what chronic pain is. We explain also how we think that the plan is going to help them moving forward. And we also assess readiness for change. So how is the patient ready to embrace this whole program, because everybody's at a different point in their lives in terms of accepting this kind of program.
First thing is really just we do a lot of education, and we hope that you'll certainly leave with a better understanding broadly of the nature of pain, some of the mechanisms involved in pain, and some of the specific things that happen when we're dealing with chronic pain. So better understanding and an appreciation of the importance and the role of the different team members. Often people come to the clinic really wanting to find out why are they having the pain and understand the reasons for their pain. And certainly that's something that we'll talk about and give you some our thoughts about as a team, but the real focus in the work of our team is how we can get people back on track in terms of their lives. So focusing on enhancing your functioning, getting back to your regular activities, and we want to, our hope is that you'll leave with an appreciation of that perspective and the team's focus. And finally, given all of that, we also want our goal is for people to leave with an initial plan about what are the steps that need to, what are the things that need to happen to help you move towards those goals of increased functioning and getting back on track with life. So we actually have a written sheet with all of our recommendations and next steps that we give to people